She forgot her daughter overnight, not gradually, not in stages. One morning she just didn't know her, and it wasn't Alzheimer's. It was something sitting in her medicine cabinet. I'm going to show you the exact medications that can cause this. 9 of them, ranked from the ones most doctors overlook all the way to the most dangerous pattern affecting millions of seniors right now that almost nobody is being warned about. But first, let me tell you what happened to her. In my years as a doctor, I've seen this more times than I can count. A sharp, vibrant person, someone who does the crossword every morning, remembers every grandchild's birthday, drives herself to every appointment, slowly starts to slip, and everyone around her assumes the same thing: she's just getting older. But that's not always what's happening. Sometimes it's the prescription she's been refilling for 3 years without a second thought. Sometimes it's the little pink pill she picks up at the drugstore for $6. Sometimes it's something labeled safe, gentle, even non-habit forming, something maybe you or someone you love is taking right now. Here's what most doctors don't explain when they hand you that prescription. Your brain runs on delicate chemical signals. Some medications quietly disrupt them so subtly, so gradually that it looks exactly like dementia. It tests like dementia. Families grieve it like dementia. And yet it isn't. The difference between those two things is everything, because one has no cure, and the other one, when you catch it in time, can actually be reversed. I've seen it reversed. I'll show you how before this video ends. But here's what makes this so difficult to catch. They prescribe it, they call it safe, but they rarely tell you what happens after years on it. The annual checkup doesn't flag it. The pharmacist doesn't mention it. And the symptoms, the fog, the forgetfulness, the confusion in familiar places get written off as a natural part of aging, so the medication never gets questioned. And the person keeps disappearing. Now I want to ask you something honestly. Have you ever felt mentally foggy and just blamed a bad night's sleep? Have you watched someone you love repeat the same question 3 times in one conversation and quietly told yourself, well, they're getting older? What if that wasn't the real answer? What if the real answer had a name, a drug class, and a solution, and nobody had bothered to tell you? We're going to go through 9 medications today. I'll tell you exactly what each one does inside an aging brain, why it's so easy to miss, and what you can actually do about it. No complicated medical jargon, no vague warnings, just the truth clearly. And by the time you see number 1, you'll never look at your medication cabinet the same way again. Do you have a bottle of Benadryl in your nightstand right now? If you do, you need to hear this, because what that pill is doing to an aging brain isn't on the label. This is medication number 9, and it has one of the most misleading reputations in medicine. Diphenhydramine, the ingredient in Benadryl and most PM or sleep formulas. It's cheap, it's over the counter, it's been around for decades, and it feels completely harmless. That's exactly what makes it dangerous. It blocks acetylcholine, a key chemical your brain uses for memory and focus. And after 60, you already have less of it. Now add a medication that actively blocks what's left every single night, and the impact is anything but small. One major study found regular use was linked to measurable brain shrinkage in memory areas. Not just brain fog, not just forgetfulness, physical changes to brain tissue, and the worst part. Most people never connect it. They take the pill, sleep, wake up a little groggier, and assume that's just aging. The pill never gets blamed. The brain keeps changing. Here's what you can do right now. If you're taking it for allergies, ask about alternatives like loratadine or cetirizine. They don't affect the brain the same way. If you're using it for sleep, I'll come back to that with something safer. Now here's where it gets worse. Medication number 8, and this one has a direct link to Alzheimer's disease that most patients have never once been told about. If you've been taking an acid reflux pill every morning for years, this is for you. Proton pump inhibitors, PPIs. Most people have been on them so long, the prescription just auto refills. No one reviews it, no one questions it. It's simply part of the routine. But here's what's quietly happening inside your body. PPIs reduce stomach acid, but that acid is what helps your body absorb vitamin B12, which your brain depends on. When B12 drops, the consequences aren't subtle. Memory impairment, depression, nerve damage. A pattern of cognitive decline so similar to early Alzheimer's that even experienced physicians sometimes confuse the two. And it doesn't stop there. Research has shown that PPIs may also accelerate the buildup of the same toxic plaques linked to Alzheimer's disease. A 2016 study in JAMA Neurology found that long-term PPI users had a 44% higher risk of developing dementia, a 44% higher risk from a medication most people take without thinking twice. So what do you do? First, ask your doctor whether you still genuinely need it. Many patients were started on PPIs for short-term use and simply never stopped. Second, small lifestyle changes like eating less at night and slightly elevating your head while sleeping can dramatically reduce symptoms for many people. And third, if you do stay on it long term, get your B12 levels tested regularly. That one step alone could protect years of mental clarity. And we're only getting started, because medication number 7, this next one, is where things get seriously concerning. It's prescribed every single day for a condition that affects millions of older adults. Doctors hand it out without hesitation. Patients take it without question, and almost no one warns them what it's doing to their brain. What comes next is one of the most overlooked causes of cognitive decline, and almost no one warns patients about it. The medication you're taking for your bladder could be damaging your brain. That's not a hypothesis. That's what the research shows. And if you or someone you love is taking it, this matters. Medication number 7. Bladder control medications, specifically oxybutynin. Overactive bladder is real. It's disruptive and embarrassing. So when you're offered relief, of course you take it. That's trust. Nobody walks into a doctor's office and asks to be harmed. Here's what they don't tell you. Oxybutynin is a strong anticholinergic like Benadryl, but more potent. It crosses into the brain and interferes directly with memory systems. And this isn't just temporary, it changes the brain itself. Studies have shown measurable shrinkage in the part of your brain responsible for memory in long-term anticholinergic users. Not brain fog, not occasional forgetfulness, actual physical changes to brain tissue. One study published in the British Medical Journal found that seniors on strong anticholinergic medications like oxybutynin for more than 1 year had a 49% higher risk of a dementia diagnosis. Nearly 1 in 2 people. Here's the problem. No one questions the medication, everyone assumes it's aging. The forgetfulness, the confusion, the lost words mid-sentence all get quietly written off, and the prescription keeps getting refilled. But there is something you can do right now. Ask your doctor about alternatives like mirabegron. It works differently and doesn't carry the same cognitive risk. That one conversation could change everything. Now this next one is sensitive, but you need to hear it. Medication number 6. Benzodiazepines. Valium, Xanax, Ativan, Klonopin. These drugs helped millions through real anxiety and sleepless nights. That relief was real. I'm not dismissing it, but here's what happens over time. Benzodiazepines calm the brain quickly, but over time they slow it down. One study found long-term use increased Alzheimer's risk by 51%, and the risk was highest with long-acting formulations, the kind that gradually accumulate in body fat, including brain tissue. Over time, the brain reduces its own natural activity in response. Memory, learning, and emotional balance all start to decline, quietly, gradually, in ways that are easy to miss until the damage is already done, and this is where it becomes a trap. Stopping can trigger worse anxiety and insomnia, so the drug feels necessary, even as it causes harm. It's one of the cruelest cycles in modern medicine. If this is your situation, never stop. Suddenly taper with a doctor and ask about options like therapy, buspirone, or melatonin. They won't work the same way for everyone, but for many people, they offer real relief without the cognitive cost. Now, medication number 5. This next one surprises almost everyone, because it's widely considered essential, and sometimes it is. Doctors prescribe it confidently, patients take it faithfully, and on the surface that all makes sense. But there is a side of this drug that your cardiologist almost certainly hasn't mentioned, something the FDA quietly acknowledged over a decade ago, something most patients are never told. After this, you'll want to rethink what you've been told about it. If you're over 60, there's a high chance you're taking this and no one told you this risk. Medication number 5. Statins, and your doctor probably never mentioned this part. Statins save lives. I'm not telling you to stop, but there's something you weren't told. Here's what matters. Your brain depends on cholesterol to function, especially for memory and communication between cells. Lower it too much, and the brain can't function properly. That's not a fringe opinion. Even the FDA added warnings about memory loss and confusion to statin labels after reviewing thousands of adverse event reports from real patients. One study found higher rates of cognitive decline in seniors on high-dose statins long-term, and this is where it gets specific. Some statins center the brain easily like simvastatin and atorvastatin. Others mostly stay out like pravastatin and rosuvastatin. That distinction matters more than most patients realize. So if you're on a statin and you've noticed brain fog or memory changes, ask, can I switch to a statin that doesn't affect the brain as much? Same cardiovascular protection. Potentially far less cognitive impact, Also ask about CoQ10. It supports brain energy and gets depleted by statin use. Now, medication number 4. This next one surprises almost everyone. It's prescribed for pain, sleep, and migraines but rarely seen as a brain risk. It's amitriptyline, and it's one of the strongest anticholinergics still used today, stronger than drugs like Benadryl or bladder medications, and yet it's prescribed routinely with little warning. Remember everything we've said about anticholinergics blocking your brain's memory chemical? Amitriptyline does that more aggressively than almost anything else on this list. A 2015 study in JAMA Internal Medicine tracked over 3,400 adults aged 65 and older across 10 years. The result was clear: a 54% higher dementia risk tied to cumulative anticholinergic exposure with amitriptyline among the top contributors. And it wasn't about high doses, even low, steady doses over years created serious cumulative harm. The decline is slow memory slips, word-finding issues, mental fatigue, and it's almost always blamed on aging. The medication never gets questioned. The damage keeps building. If this is something you or a loved one is taking, ask about alternatives like duloxetine, gabapentin, or safer options like sertraline. There are choices that do the job without the cognitive cost. Now pay attention. 2 left before we reach number 1, and number 1 is the real reason that woman forgot her daughter overnight. You're about to see it. But first, number 3 will make you angry. What's happening in care facilities right now is something families are rarely told. Medications being given not for the patient's benefit but for someone else's convenience. And if you have a loved one in one, you need to hear this next part. This happens every single day and most families never realize it. In nursing homes, hospitals, and care facilities, and most families don't realize it until it's too late. Medication number 3, antipsychotics. These drugs were made for severe psychiatric conditions and they're extremely powerful. But that's not how they're often used today. Many elderly patients are given these drugs not for psychosis but because they're confused, restless, or hard to manage. Think about that. There are seniors being chemically sedated not for their benefit but for convenience. The FDA issued a black box warning linking these drugs to increased death in dementia patients, and yet the prescriptions continue. Here's what they actually do. They suppress dopamine, slowing motivation, thinking, memory, and movement. In an aging brain, the effects are severe. One study found a 71% faster cognitive decline in seniors given these drugs, even those with no prior dementia diagnosis, in just 1 year. And the decline looks like dementia, so no one questions the medication. The family watches their loved one fade and assumes it's the disease. It never occurs to anyone to look at the prescription. If your loved one is in a care facility, ask directly. Why is this prescribed? What alternatives were tried? What's the plan to stop it? You are entitled to those answers. And if you've been prescribed one of these medications yourself, ask why you're on it and how long you're supposed to stay on it. Now, medication number 2. This one is almost never talked about, and the reason it hides so easily is because of what it's classified as. It's Ansria class most people think is completely safe, and usually they'd be right. But this one is different. Paroxetine sold as Paxil. It behaves differently. It has strong anticholinergic effects, unlike most SRIs. Unlike others like Zoloft or Lexapro, Paxil interferes with the same memory chemical we've been talking about throughout this entire video. One review found measurable memory decline within the first year in elderly patients on paroxetine, and the American Geriatric Society placed it on a list of drugs considered unsafe for older adults specifically because of this. Here's what makes this especially concerning. Paroxetine is frequently prescribed to older adults for anxiety and depression, the exact population it poses the greatest risk to. The fix is simple. Ask about switching to safer SRIs like sertraline or escitalopram. Most people transition safely with guidance, say antidepressant. Benefit, potentially protecting years of brain function. Now this is the moment, the thing that explains what happened to that woman. The reason she forgot her daughter overnight. We've been building toward this from the very first second of this video. Number 1 isn't one drug, it's something much bigger, more common and more dangerous than anything else on this list. What comes next is the most important part of this entire video. And once you understand it, you'll see exactly what's been hiding in plain sight. She didn't have Alzheimer's. She had a medicine cabinet. This is number 1, and it isn't a single drug. It's what happens when several medications from this list are taken together, prescribed by different doctors who have no idea what the others are prescribing. It's called anticholinergic polypharmacy, and it may be the single most underreported cause of dementia-like symptoms in older adults today. The average person over 65 takes 4 or more medications daily. Many take 6, 8, even 10. When several carry anticholinergic properties, they don't just add to each other, they multiply the cognitive damage compounds silently, across every refill, every new prescription, every well-meaning doctor's decision. One major analysis tracking over 280,000 older adults found that those with the highest anticholinergic burden had a 120% increased risk of dementia, double the risk, from pills sitting in a weekly organizer on the kitchen counter, and not one person did the math on their behalf. That's the real story of the woman at the beginning of this video. 3 of her daily medications were collectively dismantling her brain's ability to hold memories. When a physician finally reviewed the full picture and made changes carefully, under proper supervision, she came back. She recognized her daughter. She remembered. Names, she laughed again. That is not a miracle. That is what happens when the right question finally gets asked. So here's your action plan. 4 steps. Start this week. Write down everything you take, every prescription, supplement, and over-the-counter product. Look up the Anticholinergic Cognitive Burden Scale online. It's free and scores your medications by cognitive risk. Schedule a medication review with your doctor and ask them to assess your total anticholinergic burden. And if your concerns are dismissed, get a second opinion. A geriatric pharmacist can perform a comprehensive review most general practitioners don't have time for. Drug-induced cognitive decline is often reversible. Memory returns, the fog lifts, but your brain cannot heal what nobody tells it is causing harm. That's why this conversation matters. Share this video with someone you love. Subscribe for more, because this is what we do here. Ask the questions the system doesn't ask for you. I'm Dr. Cole Brantley. Your brain is worth protecting. Stay sharp, and I'll see you in the next one.